we want to mobilize in a plane that's definitely in the plane of the glenoid fossa. So let's talk about posterior for a second. In this textbook, the person is mobilizing directly posteriorly, whether it be in a long axis technique or with a bent elbow. What I would recommend, based on some work we've done on CTs, is that the slope of the glenoid fossa going in a posterior direction is actually in this plane. So it's not that you would want to mobilize straight posterior, but rather you would want to mobilize in this plane, as you see here. So this is the plane you want to be in. You want to mobilize posteriorly, but you want to mobilize in a lateral direction. How much lateral? Well, this particular study we looked at in younger individuals, these are people between the ages of 21 and 35, that angle was on a mean 32 degrees. So that's the angle you want to be at, is 32 degrees lateral as you do your glide. Now what about self-mopes? A patient can only come in once or twice a week. They're going to run out of visits eventually, especially in this day and age. So here's a case where we're using a towel and the person is basically pulling down in an inferior direction, imparting an inferior glide using a towel. And the way we would instruct them to do this at home is put your arm up onto a table. Hopefully the seat is low enough so you're up at 90 degrees. Put the towel just lateral to your acromion, and when you pull down with the towel, you notice this individual, he's not pulling straight down, but he's pulling a little bit lateral. Here the person is doing an anterior mobilization. The towel is placed posteriorly, and he's just pulling anteriorly. Posterior mobs with a towel are difficult for them to do on their own. Somebody needs to pull on the towel in a posterior lateral direction. So this could be a family member, this could be a friend, and most commonly it can be probably the posterior glide can be reestablished by the therapist in the clinic with probably a minimal amount of visits. If a patient is really resistant to treatment, things can get a little bit out of hand, and here's a big posterior glide, if you will.